The FCT Minister, Wike, has spoken up about an incident in Abuja over land grabbing and the confrontation with a naval officer, Lieutenant Yarima, over a disputed plot of land allegedly belonging to a former Chief of Naval Staff, Vice Admiral Awa Zubair Gambo. The federal government has ordered the implementation of Plan 15% import duty on diesel and petrol. Hello everyone, welcome to the program. This is Politics Today, live on Channels Television. I'm Sean Akimale, right here in Abuja. Let's bring you up to speed with the latest stories in the land. We begin with the story of the Minister of the Federal Capital Territory, Wike, who is now speaking up about the incident that we saw over the alleged land grabbing matter in the FCT, involving a confrontation with a naval officer, Lieutenant Yarima, over a plot of land allegedly belonging to a former Chief of Naval Staff, Vice Admiral Awa Zubair Gambo. The minister was talking to journalists ahead of the FCT Executive Council meeting earlier today, where the minister condemned what he described as a retired naval chief's impunity in deploying serving officers to guard the disputed property. He was responding to critics who faulted his visit to the site. The minister says he could not sit idly by as a public officer while government officials were being attacked. Take a listen to him.
Respect institutions. And I know what it takes. Even as a governor, no governor will say that they supported the military now. Individual. You are against the law. It is not military versus government. No. If it was military, I would have written to them that look, military, why are you doing this? This is a private individual. Land was not allocated to him. Land was allocated to a company called Santos in 2007 for parks and recreation. They applied to the former minister for change of use. The minister refused. The man went, started selling land. Maybe the former chief staff fell into their scam, sold.
That's the minister of the FCT, Wike, over that incident that happened a few days ago. Now, so much to talk about, especially as it concerns Nigeria's health situation, is what the president and his party, APC, what they promised Nigerians, are they fulfilling? I'm going to remind all of you what they said at the campaigns, what the government says it will do when it comes to health. What are they doing? What are the present realities Nigerians can hold them on to? We're asking those tough questions now on the program. But before we get started on that, let's check out some of your political roundup stories.
The Senate has moved to outlaw the recruitment of persons under the age of 18 into the military as it passed the Armed Forces Repeal and Reenactment Bill 2025 for second reading. The provision, which prohibits the enlistment of minors, aligns with Nigeria's military practices with the Child Rights Act of 2003, the United Nations Convention on the Rights of the Child, and the African Charter on the Rights and Welfare of the Child. The bill, sponsored by Senator Abdulaziz Yaradua, representing Katsina Central, seeks to repeal the existing Armed Armed Forces Act 2004, replacing it with a constitutionally compliant and operationally responsive law. And the House of Representatives has voiced concerns over conditions for writing the 2026 Wike examination, brought up as a matter of urgent national importance by Honorable Kelechi Mogu. The House says it is worried about the outcry of the NUT and public schools in rural areas over the lack of electricity and functional computers. Lawmakers have asked Wike to suspend the CBT policy with immediate effect while calling for the recruitment of computer teachers in public schools. And it's barely 24 hours to the National Convention of the People's Democratic Party scheduled for November 15 and 16 in Ibadan, Oyo State. And despite the recent conflicting decisions of the courts regarding the convention, the party's Board of Trustees, led by former Senate President Adolphus Wabara, says the exercise must hold. Mr. Wabara said this after receiving the reports of the Reconciliation Committee set up by the Board of Trustees to reconcile all warring groups within the party. The committee, which says it met with the Minister of the Federal Capital Territory, Mr. Wike, the PDP's National Secretary, Mr. Samuel Anyanwu, and the former Senate President, Bukola Saraki, was led by Ambassador Hassan Adamu. And following alleged manipulations of results and other crises connected with the governorship primary of the African Democratic Congress in Ekiti State, one of its governorship aspirants, Emmanuel Fayose, has rejected the election results announced on November 6. Consequently, he's been calling for a total cancellation of the primary election. Speaking in Ado Ekiti, the state capital, Fayose explained that there was violence, intimidation, and vote manipulations during the elections. The leadership of the All Progressives Congress believes the party is strengthening its internal democracy and creating mechanisms to accommodate all political actors coming on board for the administration of President Bola Tinubu. The Deputy National Chairman of the party, Mr. Bukar Ali Daluri, said this when he received the former state chairman of the People's Democratic Party, Mr. Joel Madaki, into its fold. Meanwhile, the leadership of the PDP in the state has dismissed the relevance of his defection, describing it as mere political propaganda.
So let's tell you that there seems to be some kind of suspension. The federal government has asked for the halt in the implementation of the 15% on import duty on petrol and diesel. All right, then. Let's get to our conversation on the development in Nigeria's health sector. The federal government has activated its National Emergency Health Response Framework following reports of a possible outbreak in parts of the country. The Honorable Minister of State for Health and Social Welfare, Dr. Adekunle Salako, has assured Nigerians that government response teams are fully mobilized with surveillance and containment measures now underway across the affected state. Authorities say there is no cause for a panic, but citizens are being urged to remain vigilant, observe personal hygiene, and follow official public health advisories. Tonight, we'll be asking questions on what next to do and what Nigerians should prepare themselves for in the case of any pandemic or health emergency. Honorable Minister for State Health, Dr. Isiaka Adekunle Salako, is live for us on the program to give us perspectives and insight into some of these issues. Honorable Minister, thanks so much indeed for joining us tonight.
Thank you very much, Sean. It's my pleasure to be here.
Thank you so much, Doc. Let's clarify. I'm worried, and I'm very sure that a lot of people who walk around here and a lot of people who live in the city, and not only in Abuja, there seems to be these flu issues going around town. Is there some kind of strain of COVID, or what exactly is going on?
Well, thank you very much once again. This is not every flu-like illness that we can ascribe to COVID. There is a season for flu, which usually happens when we have high humidity that's able to retain a lot of particles in air, and that may also retain bacteria, infectious agents, and that can lead to increased incidence of flu-like illnesses, generally speaking. Right now, we do not have anything to panic about in terms of the health security of Nigerians, but as a government, that is 24/7 preparedness that is always in place. in terms of ensuring there is a constant surveillance. All health workers know that there's some disease incidents that they must report to the health authorities. And if there's a more than normal increment in any type of illness at all, because for every illness, we have what we can say as the baseline, as it were. So if in any location we have more than an increase on the baseline, they also have the responsibility to report through the reporting mechanism to the authorities, and that can alert a deeper look into what is going on in that place. And then when we now take a deeper look and we suspect something happening, then we can do further analysis, and at the end of the day be able to determine what is going on, and then that follows, the chain of reaction then follows. So right now we have nothing to worry about as a country. Our level of ability to prevent diseases, and when prevention fails, to detect and to respond has generally increased since COVID-19 pandemic. And the last joint external evaluation that was done in 2023 has clearly shown, and this evaluation was done by an external body, not by Nigeria, has clearly shown that Nigeria has moved from about 39% pre-2023 to about 54% in 2023, which means that we have increased on our capacity, our ability to prevent pandemics, to prevent infectious diseases, to detect them when they occur, and to respond to those diseases.
I know you are a Yoruba man, so you are familiar with Agbo. Agbo in the local parlance, and literally translates to herbal alternative.
Absolutely.
And when growing up, they literally will put the Agbo in a hot bath. And you'll be covered, and when this flu comes, they literally will just cover you up, and after 30 minutes or 15 minutes, you steamed up, and all of the flu will run away from it. But is the government looking at the trado medical or the traditional medicine alternatives, that the herbal medicine alternative? Are you encouraging it, or what exactly are you doing? Because there are those who will say, look, these herbs, we are not making use of it, but some of the medication, the Western medication line are also extracted from a natural source.
Absolutely. Yes, you are right. Right now in the ministry, we have a department of traditional, complementary, and alternative medicine, which is headed by a director. And we have encouraged a similar department or even agencies to be created at state level. I cannot say exactly how many states are responding, but some states are already doing it. Ogun State, which is my state, for example, have an agency that is regulating and looking on how to improve traditional medicine practice, complementary medicine practice.
So these guys are different from the native doctors?
Yes. Well, it really depends on how you look at it. If it's people who do chanting and all that, that is spiritual level.
Yeah.
So, and it's difficult to put spiritual things into regulatory framework because evidence are difficult to put forward when it comes to spiritual issues. But when it comes to physical things, putting one herb to one herb, and that's a physical phenomenon, and we can look at the effectiveness of it, we can do clinical trials around it. As a matter of fact, I can tell you that one of the medicine that is being used today globally for the control of sickle cell, crisis in sickle cell disease, was extracted from a herbal medicine in Nigeria. It was developed here in Nigeria by an agency, the Nigerian Institute for Pharmaceutical Research and Development, and it's today being prescribed in over 40 countries of the world. So, which means that there's a lot of potentials in our herbal medicine. About 3 or 4 weeks ago, I listened to some researchers, had a meeting with them from one of our universities in the northern part of Nigeria, who have tested a herbal medicine that they have found very effective against cancer of the brain in animals. And we're taking that discovery further to be able to go through the spectrum of clinical trials, of ensuring that we're able to refine that and probably make it available as part of the armament around fight of cancer. So we have a lot of phytomedicine resources in our country, And one of the things that we have done is we have put together a committee that is basically charged with phytomedicine development and commercialization. Because there are two areas. If you develop it, if you do not commercialize it, then it will not be attractive to investors to invest in it. So we have put together a committee which is working on that, and learning from the example of this sickle cell drug that I spoke about, we hope we can also put together a lot of our local phytomedicine resources to be able to support some of the health agenda of our country.
The former INEC chairman, there is a popular Abalaka, and those who have said they found a cure through the alternative medical solutions to some of these issues. A lot of people will remember, even during COVID, there are people who are putting some solutions together, and whenever it's all of these things, they are not being encouraged and all of that. But the fundamental question is, there is no strain of COVID, not established as of now. It's just flu that comes with the season, and it will soon pass. Is that right?
Correct.
You today had talked about medical emergencies and how now, and pandemics, and how ready Nigeria is. And we've heard this so many times, until Ebola came, until COVID came, and states like Lagos rose up to the occasion, if not because of the kind of healthcare resilient program that Lagos, for example, had. Ebola would have been a disastrous situation for Nigeria, and we have a very prominent, now very respected doctor who died in the course of protecting the rest of Nigeria from that issue. When the issue of COVID came, we discovered that our health research institute were moribund. We discovered our capacity to produce any kind of medical products, to either as gloves or whatever. We couldn't just do it. Has anything changed? Did we learn anything?
No, absolutely. A lot has changed. COVID was a lesson to the global health community. And if you domesticate that in Nigeria, for example, our capacity to be able to quickly do tests and detect what is going on has more than quadrupled since COVID. Now we have about 7 laboratories that can do what we call genomic sequencing. That means they can take a microorganism and identify to the last detail the genetic makeup of that microorganism, which will help in a lot of things, in vaccine development, in proposing a treatment option, and so on and so forth. Our ability to be able to do surveillance, to respond, like I said, has also significantly increased. Today, we have what we call emergency operations centers in all the 36 states plus Abuja, which we didn't have pre-COVID, which means that there is now a center organized that is meeting on a periodic basis, that is reviewing data that is coming in and able to see whether this data is going abnormal, and able to then study the abnormality and determine whether that abnormality needs further analysis. So our preparedness, and I must say, even during COVID, Nigeria did not really do badly in terms of our response. Yes, our capacity to manufacture some items, especially vaccines and antiretroviral drugs, was dependent on imports. But clearly, in terms of the public health containment measures that we put in place, we did not do badly. And if you compare the data that we had with several other countries, you will see that our data was not bad at all. And when it now comes to the issue of some of these medicines that are being people showcase and say that it can cure this, it can cure that, there is a scientific protocol that any drug needs to go through for it to be certifiable and prescribable. It is not enough to say, I use this drug on 2 or 3 people and it works. That means it's going to work. Because sometimes some diseases are self-limiting. Whether you use drugs or not, those diseases, because they are self-limiting, at a point in time, they will terminate on their own. So if you use a drug and then it is a disease that is self-limiting, you may come to the wrong conclusion that it is your drug that stopped that disease. However, in able to go through a scientific protocol, you go through several stages of clinical trials, first with animals, and when you are able to go through animals or laboratory animals, then you can move to human beings, and there's a protocol that you must follow. It is when you have followed that protocol that we can feel confident that, yes, this is working for this disease, and this is the dosage, this is the amounts that could be used, this is the periodicity of use,
Minister,
and so on and so forth.
Minister, are we able to produce vaccines locally now?
No, unfortunately not. But one of the key elements that Nigeria is driving under the presidential initiative on unlocking the healthcare value chain is to see how we can promote local vaccine development. However, I must say that it is not enough to just say you want to produce vaccines, because first you must look at the comparative advantage. If you are going to produce it and it's going to cost more from the one you are currently getting, then what is the point of producing it locally? So you must do all the analysis. The other thing is that you cannot, yes, Nigeria is a big country, 240 million people or more, but when you produce a vaccine that is not globally being used, then that is also a challenge. So it is something that one does not rush into, because it's a high-end technology that is needed into doing it. But clearly, one of the key initiatives and key direction that this presidential initiative is working around is to see how we can.
It became an issue of, it came down to issue of security at the end of the day during the COVID, where countries are now depending on other countries. And you say the most powerful countries, what they did was that they put all their resources, and the lesser or the weaker countries are now begging and rubbing their arms together in hate and in support from bigger countries. Now, a lot of the times, the ability of the country to cater for its own citizen is very key. And the last time I spoke with the Minister Party, he promised and he told Nigerians that our ability to produce pharmaceutical products in Nigeria is increasing. And there are private sector initiatives that are even kick-started under this administration. And I like to put your feet to the fire as a government, because this government, your political party, APC, made several promises, from budgetary allocation to health sector, to the issue of brain drain, to health workers and primary health infrastructure development, to issue of expanding health insurance and universal coverage and health financing. A lot of promises were made to Nigerians. Some of the issues that sway the vote of some Nigerian voters. But the question would be, how much of that have you performed? What have you delivered in that area? What are the critical areas that Nigerians should look forward to say, APC promised this, what have you delivered? It's 2 years and over.
Well, absolutely. I must tell you that over the last 30 months that President Bola Ahmed Tinubu has been at the helm of affairs in our country, in the health sector specifically, there are a lot of positive things that we really can point at. If you look, for example, at our vital health data, in terms of maternal mortality, in terms of under-5 mortality, in terms of skilled back attendance, if you compare where we are today, and I'm going to use this book, which I hope every Nigerian will own. I'm going to give you a copy so that you can also study it. This is our scorecard.
Okay.
What we have been able to do, reflecting
in 30 months.
In 30 months.
Is there a digital version that is available?
Yes, a digital version.
Can Nigerians be able to access it?
Yes, it will be available on the website of the ministry. I cannot confirm whether it's currently available, but it will definitely be available on the website of the ministry that people can download. And it is a scorecard. If you look at what we did, we looked at our approach under 4 pillars. And we have scored ourselves under those 4 pillars in this JAR book. We also looked at ourselves under what we call the cross-cutting enablers, because there's some issues around healthcare that is not strictly for any pillar. For example, issue of financing, issue of digitalization, issue of power. These are cross-cutting issues. We have looked at ourselves around all these issues, and we have scored ourselves.
Let's take it one after the other.
Okay.
You mentioned one area that is that is of key interest to me, and I know that there is a Harvard-trained medical doctor who is working on your team at the Ministry of Health, who is focused on digital health. That young man, and I'm hearing what you guys are doing in that area. How significant is digital health to the Nigerian system? What have you done in terms of digitalization of healthcare delivery?
Well, what we have been able to achieve is that first, at the federal tertiary health institutions level, about 78 of them, I can tell you that close to 80% of our federal tertiary health institutions are today digitized. Some 100%, some less than 100%. The range is between 100%.
What does it mean when you say you have digitized?
What it means is that, for example, if you are 100%, that means once you come into the hospital, from your entry into the hospital to your exit, there is no point in time you have to carry paper.
Okay. Are you able to do it on your mobile too? Your mobile phone?
Yes.
Or just at the entrance of...
Yes, some hospitals are also able to do appointment on phone, on an app that has been developed. You can
does the federal government have any mobile application or any online or any web application that you can access healthcare, either in terms of inquisition or plan or booking or whatever?
What we currently have are applications that are used by facilities, not the general federal government. But as an example, the Federal Medical Center, Abuja, is 100% digitized. You can book your appointments online. You get to the hospital. You don't need a card. You just produce a digital card that is used to retrieve your history on the screen, and they send you to your doctor. The doctor see you on the screen.
Which hospitals are these?
Federal Medical Center, Abuja.
Okay, is the first one.
Or how many of I'm just using that as an example. Like I said, about 78% of our hospitals are digitized, but some of them are
federal hospitals.
So
these are federal medical centers,
medical center, teaching hospitals, specialist hospitals, and so on and so forth.
And so you are doing it across board.
Across board.
So it's about 78%
of them. Yes.
All right. Give me a moment, Minister. When we come back, I'm very particular about child care health and maternal mortality. I'm hearing that there are a few reforms that are being done, but how many Nigerians are aware? I understand that CS is being subsidized. But who is aware? Who are those benefiting? Are you only giving this to your political party members, or how is this being administered? I'm going to also know about cancer treatment in Nigeria. Those people, some people are complaining that they cannot have access to it, but we know that there are more centers to treat cancer. This and more after this break, everyone. Join us again. Thanks so much, everyone, for staying with us on the program. The Honorable Minister of State for Health, Dr. Adekunle Salaka, has been speaking with us on the program tonight. Let's get back to the conversation. The promises made by the Tinubu government and the APC, they made far-reaching promises, and they said they will do this, they will do that. But how far have they done all of those things they said they would do? First, I'm concerned about child health care and maternal health care. The CS and the subsidy, how many hospitals are there, and what exactly are the details? Where can Nigerians be able to access some of these facilities or this healthcare?
Okay, first let me conclude on the talk around digital health. The ultimate direction with digitalization in our health system is a situation where if you have an healthcare service in Kano and you need to do in Lagos, you will not need physical case notes to be able to assess your record. That is the ultimate direction that we're going.
So to break it down, if, for example, like Federal Medical Center Ebute-Metta, which we're trying to fact check you whether or not what you are saying is right, and that's on the screen right now. So we went ahead and checked the Federal Medical Center Ebute-Metta, which you mentioned, and we saw that truly you can book an appointment with a doctor. So let's assume that I live in Lagos in Ebute-Metta and I use Federal Medical Center. And then I've done my tests, I've been seeing doctors there, but for some reasons I've had to travel to Bauchi, for example. I do not need to go over my health history.
Right now, that is not available.
Okay.
But that is the ultimate direction.
Okay.
Having a system where there's information exchange between all hospitals and at all levels, at primary care level, at secondary care level, at tertiary care level. But this process is usually one after the other. You cannot do information exchange to start with. You have to first digitize the systems. It is when the systems are digitized that you now connect them together. So digitization of the system has started.
So you can do antenatal cardiology,
FMC,
book an appointment with a doctor, urology, so you don't have to go and sit there.
You don't have to.
So you can...
and this is what is being reproduced in a few other hospitals, and eventually this is what we want to achieve across our health system, not just at the tertiary level, even at the primary care level. This is what we aim to achieve. And we have challenged ourselves that by the end of 2027, we should be able to provide this to Nigerians.
All right, fantastic. If this works well, I hope it works well. If this works well, this is a fantastic idea. These are the kind of things that you will see in abroad, where a lot of Nigerians go to visit. And there's a lack of trust in the Nigerian public health system. And that is what you are trying to reawaken, is it?
Right, correct. Absolutely.
Okay.
Absolutely.
Now, tell me about
maternal health, child health.
Yeah.
Let me start with maternal health. One of the, yes, we're not where we ought to be in terms of the maternal indicators in our country. If you look at the resources in Nigeria, our status as a country, and where we really not ought to be compared to our peers, we're not there. But there has been some significant improvement over the last 30 months. What we discovered is that 50% of the maternal deaths, or 55% of the maternal deaths in Nigeria occurs in about 22% of our local governments. What that tells us is that if you focus a few more attention on those 22% of local government, we can significantly reduce maternal death. And that's what we have done, to design a special program to focus attention on those 172 local governments in Nigeria called MAMI. Right now, we have a hotline. I think it's 58. I'll confirm the number and let you know. I don't want to mislead the public. But there's a hotline that if you dial that hotline, somebody will respond to you at the other end and ask you, what do you need? We found out that what are the key issues? The first issue is decision from home. We really cannot influence that. We can't decide for a family when to go to hospital. But when you decide, movement from home to the hospital is a challenge because that causes delay. So we have now created an ambulance system that you can access through this hotline. And this is already being scaled up gradually. It is not national yet, but it's being scaled up gradually so that if you are in distress as a pregnant woman, you call that hotline, somebody answers you at the other end and arrange for you to be transported to the nearest hospital where you can be taken care of. And significantly, over the last 1 year or thereabout, when this was started, we have noticed a 16% reduction in maternal death in those 172 local governments.
So you pick a sample, a model local government area to begin this with?
No, we focus on where the mortality is highest.
Is highest?
Yes.
So were they more in the south or the north? Or they are spread
it's not
across?
important. It's across Nigeria.
Okay, so
it's really across Nigeria.
Now, the issue now is that you now have ambulances closer to those local government areas. So we can, if we, and I'm trying to, for our backroom staff for us to be able to extract that because it's important.
Yeah, it's called Save Mama. I think it's 5.
Yeah, we will get it in a bit.
Yeah.
So when we get that number, I want our viewers to be able to take advantage of it, wherever they may be watching across the country, to be able to take advantage of that number. So they call that number. Is it toll-free, isn't it?
It's toll-free.
It's toll-free. You call that number, you state your problem, and this is about maternal health.
Maternal health, right.
Alone. So you call, and is it free? Is maternal health free in Nigeria?
Well, to some extent, I must say. First, it is not everybody who cannot afford cesarean section. Some can afford it. So, cesarean section that has been provided free is for some category of Nigerians that cannot afford it. So, when you get to the hospital, your social system is going to be checked, and it's going to be confirmed that, yes, you belong to that social strata that cannot afford to pay for cesarean section.
How much is an average? How much is a cesarean section?
It varies, really, from hospitals to hospitals, but the high end will be in hundreds of thousands, and the low ends will be around maybe half, 120, 150, thereabouts.
1,000 naira.
1,000 naira.
And that's a lot for for people in the lower strata of the society to be able to afford.
But don't forget,
yeah,
it is a preparation of 9 months.
Okay.
It doesn't happen suddenly. It gives you 9 months to prepare for it.
Yeah.
So, yes, we recognize that some people are in the very lowest strata that cannot afford it.
Okay.
But clearly, if you really, really prepare for it, a lot more people will be able to afford it.
The federal government is offering free cesarean section for those they confirm to categories of Nigeria. But I've been able to confirm for you, Minister, that hotline is 3581.
Yes, 3581.
Save Mama. We're going to put it on the screen. And when we put it on the screen, you'll be able to, maybe you have a family member, you have anyone, you have friends, you have your neighbors. Within some of these local government areas, I wish that we can have access to those local government areas that people, if they know it, they know whether they belong into that local government area.
172 of them is not something I can...
No, I know. I'm not asking you to cram it, but I'm saying that if we have maybe a portal where people can know where they are, we can help you and put it on our website or something, just to educate people to know where. So it's 3581, the hotline 3581, Save Mama initiative by the federal government on maternal health. But we take another break, everyone. When we come back, the Japa syndrome. Why should any medical doctor stay back in Nigeria after their training when they are being highly sought after in the UK, in the US, and in the Gulf? We'll be right after this break to discuss that and more. Everyone at the home stretch now. On our conversation with the Honorable Minister for State of Health, Dr. Adekunle Salako. Thanks so much, Minister, for your time.
Thank you very much.
There are those who will say, why should any Nigerian who is trained here and who sees opportunity to work in the US and the UK or in the Gulf where they're highly sought after, stay back? And considering the welfare issue that they've always talked about, take, for example, the resident doctor strike, and what they've been talking about welfare. Does this government look serious about those issues?
Well, first let me say that there's a global shortage of health workers. And when there's scarcity, there's going to be a lot of movement. Whether in the US, whether in the UK, whether in Africa, there's scarcity of health workers. Yes, we are particularly challenged in Nigeria and most parts of Africa because of economic issues, generally speaking. The truth of the matter is that in Nigeria today, if you look at the salary scale within the public service, doctors, health workers generally, are one of the most well-paid within the environment of Nigeria, the economic affordability of Nigeria. You know, if you compare, for example, the salary of an average health worker to the salary of an average civil servant, you will find out that there are about 25% difference in favor of an average health worker. So which means that government in Nigeria places priority on the remuneration of health workers, but that has to be done within the affordability index of Nigeria. It's also important to state that whereas we cannot stop people from migrating, the work of a health worker cannot actually be paid for by anybody in the world. Health work is something that you cannot cost. If you have a land and you approach a lawyer, for example, you can actually put a cost to your land and tell the lawyer that if you help me recover this land, I'll give you 10%, I'll give you 20%. It is not the same thing as health. If you have a headache, how much does headache cost you? That you're going to tell the doctor that if you take this headache away, I'll pay you. So health is one area that cost recovery is almost impossible.
But this government promised that they are going to reverse the Japa syndrome when it comes to healthcare.
Hold on, I'm building it up. Now, what we have done as a government, first is to look at the entire landscape of health workforce migration and come up with a policy that we call health workforce migration policy. The key ingredients of that policy are: one, how do we remunerate better? How do we provide additional incentives apart from remuneration? How do we ensure that even when doctors migrate, when health workers migrate, they migrate in such a manner that they remain assets to Nigeria? And how do we produce more health workers in Nigeria? So those are the four key areas that we are addressing one after.
So we need to go now, Minister. We're totally out of time. But the NAD, the resident doctor issue, what is this government doing about it?
Yes, the resident doctors issue, if you look at some of their demand, 19-point demand, about 70% of those demands outdate this government. We attended to, I still have a meeting with them this evening, and I can assure you all of them are being carefully attended to. We want a situation where we produce, at the end of the day, a sustainable solution, not a quick fix solution that 1 month, 2 months down the line, we're back on strike again.
Dr. Adekunle Salaka is the Honorable Minister of State for Health. Thank you so much indeed for your time tonight.
It's my pleasure. I appreciate it. Thank you very much for having me.
That's our show for today, everyone. Many thanks for watching. I'm Sean Akimale. God bless Nigeria.